Thank you very much, Dr. Gravenstein. Like Ernst, I'm a family doctor as well. I've owned and managed my own community clinic for the last 17 years, along with my spouse, Dr. Rosanna Arcega, here in the audience. And when the PCNs first came into existence, this PCN over 10 years ago, we were eager to join. And the last 5 years I've been on the board, and the last year the chair. And it's been a tremendous experience. It's an on-the-job learning opportunity, and it's expanded a great number of colleagues who have become friends. And I really commend the 10 of you tonight who stood up to be on the ballot, and however the results turn out, keep turning up and putting your name on the ballot. And I might do again sometime. I'm going to take a little break, but share, that some others have that experience too. But it's, the PCNs are, as far as I know, they're uniquely, they started in Alberta under Gary Marr, I think, and a unique entity in Canada, really, having service providers like ourselves at a table that influences policy. And it's important that we back them, and we do that by being engaged. So I know I'm preaching to the converted right now, but I know each of us know somebody or two that aren't here. So when we go back tonight, tell them that it's not so bad, we don't bite, come out next year again. And thank you, because that'll help us to stay active and strong. The next slide. So the last little while, I just wanted to go back over, we've had a bit of an inward review, I call it cleaning house a little bit, restructuring. And we actually redesigned the subcommittees of our board, which doesn't sound exciting, but when you're on a board meeting, it makes a big difference. We now delegate work in a much more efficient way. Things get done more effectively. We restructured the board itself. We've added 2 public members to the board now, and we've invited our 3 Alberta Health Services partnerships right to the board every meeting as well. These are some of the changes we've created from scratch, a PCN policy manual, upon which is the scaffolding of our PCN that will operate in the future. And over time, we've transitioned from what would be called an operational board, in a sense, to a governance board. And you'll hear a lot of that word in your experience as you get onto a board now. And governance means we don't put our fingers in the pie so much. We stand back and we look at the bigger picture, we set priorities and goals, and then we trust our executive team that are highly competent under Christopher Cameron to execute those objectives, and we measure and guide along the way. I remember back to my early days in the PCN, and one of my partners was on the board, Dr. John Coppola, with Waldy here, I think, too, and there was a lot of work going on. The board would decide to open up an after-hours clinic somewhere, and the board directors would sometimes go out and be heavily involved and have to do the work and find the space, rent it, and hire people, do the shifts until others came along. And I was scared silly to come near a PCN board because I saw the hours. It was a lot of work. And it's been an evolution over the years of size and organization, and now it's not like that. So you get on the board and you talk together, you debate things, and you come together and make decisions, and then the ends that we form, the ends policies, become the goal of the PCN, and then we watch that. So I'm going to talk a little bit about our PCN ends here. So first we have the provincial objectives. The next slide. Oh, sorry, that was provincial. I didn't see that. Sorry, Dan. So we, of course, don't exist on our own. We exist within our healthcare system and within the province, and our province has objectives. They're right there for you to see: health needs of the population, patient medical home, partnerships and transitions of care, accountable and effective governance. And of course, those objectives were set in part with influence from all of the activities that go on within the PCN boards, and that's why it's important to have your voice here too, because you have a chance to influence things all the way up. So our first global ends policy that we set is the big picture. That's what we really stand for. It's the overarching picture. And essentially it says that we exist as the PCN so that you can address your patient's needs and exceed your professional standards. And that's the overarching goal of everything else. And underneath that, we've set other individual ends, one of them being membership. So our PCN's objective is that the members, yourselves, influence and shape the services the PCN provides such that they will better meet the needs of your patients. And the method of doing that is by listening to you. You saw tonight we have the listening corners out there, and we'll all be available to talk to tonight. There's been focus groups, and Christopher is the expert on the methods, but there's been a number of attempts in this last year to take in your feedback in a meaningful way, and that will continue to go. And that's under our objectives of membership. And the next main end policy is population health. We have 310,000 patients attached to our members currently in our PCN. There are about 20,000 unattached patients in our territory. And of course, it's our responsibility to look after all of the patients in our area, not just the attached. We have a high percentage of that. So our PCN will develop programs and partnerships to assist in the care of all of the patients within our territory. The next end policy is the patient medical home, which the College of Family Physicians of Canada endorses, of course, as the vision of family practice across Canada. The PCN will support you in building a patient medical home linked to a wider range of services. That's its goal. By partnering with Alberta Health Services and others. Also, by participating in the patient medical home model yourself, you then become able to access our PCN resources designed to help you meet your patient's needs. And then transitions of care is another end policy. As I said before, we don't practice alone, and our patients certainly don't exist alone. They exist in a system of various levels, and it's very critical that we have an important role in how they transition from one level to another, where the PCN will help connect the patient medical home to a broader healthcare system. And the PCN will partner with, again, Alberta Health Services and others to help us guide our patients between levels of care. So the ends policies are our best reflection of the provincial objectives, but done so in a way that we think will benefit us and our patients the most. And just a reminder again of that global concept that we exist in order for us to meet our patients' needs and to exceed our professional standards. So those are the main objectives that this board has come up with over time, and the course is set as it is really, and the job of the board and the executive is to continue to execute this through time. And I look forward to talking to you afterwards if you have any questions about that. Thank you very much.